Here's a quick and easy way to cut the right shape hole in a stoma bag. So stoma bags come with a small hole already in them, and if the hole you require is different, then you can create a template. I use a positive template as I find it easier to draw around, but you could use a negative template, as in one of these. That's if the circle is actually round on the patient. It may not be, it may be oval shaped. So here's my template, and I'm just going to line it up using the concentric circles. Just line it up so that it's in the middle of the circle, both at the top, bottom and the sides. And I use a Sharpie pen. And I draw around the template. And I take a normal scalpel. Now it might seem a bit alarming because you don't want to pierce the thin film inside. That's absolutely vital that you don't pierce that. So one mustn't push too hard with the scalpel. But having said that, it naturally stops cutting when it reaches the membrane on the other side of this gelatinous material. So I'm just going to carefully cut around the line, and you may need to practice this on a couple. Be prepared to throw a few away until you feel the right amount of pressure, but actually it's hard to do it wrong, and you'll see how we can check it in a minute. Try and make sure you line up the final cut with the beginning where you started. So now you can peel off the outermost piece, discard that, and here comes the magic bit. You put your finger in the hole and then gently pull away from the side the material, and continue this all the way around. And this is where you can check that your scalpel hasn't gone all the way through. You can still see it's shiny, you can still see the material through the gap, contrasted with your finger as you go round. And just pull, don't pull this bit, you don't want to distort this section, you're only pulling this bit which is going to be discarded. So I'm just pulling that away, but I'm also checking that there's no puncture or cut that's gone all the way through, and that's fine. Once you've done that, you can easily take your pair of eyebrow scissors, and you can easily, using your finger to make sure you don't go all the way through, easily just puncture a little hole in this very flimsy membrane that's left, and just cut around that. It's extremely easy, much easier than trying to cut through the whole of the thickness of the material. It really is just like cutting a very thin membrane. Obviously I'm taking longer doing this on camera than I would when I'm actually in the zone, as it were. Then you discard that bit and you're left with a beautiful, perfectly cut out shape. And if you have a look inside, there's absolutely no tear to the inner plastic, no punctures, and there you have it.